This is the second video about the penile fillers in continuation with the first video. So we discussed about the hyaluronic acid, which is the most common penile filler used. So in this video, let's discuss about the technique of the penile fillers and the type of anesthesia that is given. So usually we prefer a man to be circumcised to get the best results with the penile fillers, but there are men who prefer to retain their foreskin or the prepuce. So we also do penile fillers in men who have a prepuce also. So although the preferred is those who are already circumcised. The technique is, first we usually put a spray on the penis as a numbing spray, and then we give a penile block injection, which is a local anesthetic injection, which is mainly the lignocaine and probably to some extent a bupivacaine. And this penile block anesthesia injection may take around 10-15 seconds to inject, following which in 1 to 2 minutes time the penis will usually become numb, so that we can proceed with the penile filler injection. And once we give the anesthetic injection, then we usually do the markings on the penis. We divide the penis into 4 different quadrants, and then we inject more towards the base and slightly less towards the distal part of the penis, that is towards the glans. In circumcised men, yes, we may inject equally, that is half proximally and half distally. So we use around 10 ml of the fillers to start with, although some patients request to put 20 ml, but it's safer to start with 10 ml, and if required, in a second sitting we can add 10 more ml. So the 10 ml, we give 5 ml proximally and then 5 ml distally. And then this injection may take around 10 to 15 minutes time, during which the patient will usually not experience any pain, because we would have given the lignocaine injection as a local anesthetic, and also the filler that we use also along with the hyaluronic acid, there is lignocaine, which is already the local anesthetic. So the filler itself also has some numbing effect, hence you will usually not experience any pain. And see, if you heard about the fillers on the face, that is usually given to the dermis of the skin, that is to the skin layer itself it is given. Whereas in the penis, we don't give it to the skin layer, we give it in a layer below the dartos muscle. So dartos muscle is a thin layer of muscle that is present in the penile anatomy, and we give the fillers just below the dartos muscle. And the technique as such, it comes with experience, since we urologists, we do significant number of surgeries on the penis, so we are well experienced with the different planes of the penis. And once the filler is given, it takes around a week's time or a 10 days time to completely settle. And we usually apply mild compression dressing, because we would have given the injection at multiple places. To prevent hematoma, we do apply a dressing, and then we add some medication so that you get good erections for the next 2 weeks, so that there is uniform distribution of the fillers.